So far, we've concentrated on the medical aspects of dementia. But as we've seen, patients are a diverse group. Increasingly, primary care is working with organisations outside the NHS to meet their needs. At the beginning, you mentioned the Alzheimer's Society. What's the logic, if you like, in drawing on their advice in putting together this training package?
When developing this training package, we wanted to make it very much based on the experience of people with dementia. People who are living with dementia, their carers, have a huge amount of experience and knowledge, and that's something that we need to learn from. But an organisation like the Alzheimer's Society is active across Wales. It's a politically active organisation, but it's also actually working within our communities. It's supporting the people we're looking after, and it's a group that we need to be thinking about working more closely with in our local practices, in our local communities.
Organisations like the Alzheimer's Society address a wide range of the non-medical aspects of living with dementia. So how can people with dementia live well?
What people with dementia has told us through various surveys is what they want to be able to do is to live their lives as well as they can possibly do so. So they want the people living with them and the wider community to understand their condition, to be supportive of their needs, to live their lives, to be as independent as possible for as long as is possible. So they still feel engaged with their community. They might need people to support them. It might not be their carer who is able to do that because the carer might be working themselves. So services like the ones that Alzheimer's Society and other organisations provide are about perhaps relieving the care from the carer and supporting the person with dementia to do what they would like to do, to live their lives.
How important is early diagnosis, or for that matter, diagnosis at any stage? How important is it to have a diagnosis?
What diagnosis does is unlock the door to the support that's available, the information that's available, and as importantly, if not more importantly, the medical treatments that are available. There are anti-dementia drugs out there that can help stabilise the condition, provide people with the opportunity to make those decisions about their future lives and to be engaged with those decisions. So it's really important that diagnosis is made at an early stage so that people can start having the choice and take control over their lives and over the decision making that inevitably there will be once they understand what a diagnosis of dementia means to them and to their family and friends.
What do we know about the rates of diagnosis of dementia?
What we know in Wales is that there are over 45,000 people living with dementia in Wales, but only 27,000 of those people will have a diagnosis. I think part of the problem has been that diagnosis of dementia has meant doom and gloom. There's nothing we can do. It's a progressive illness. There are no services there to support. Go away and deal with it. That absolutely isn't the case now, that diagnosis is important in terms of unlocking information and support services, etc. So if GPs know that there is something out there, that they are actually at that point offering something positive, they are giving people the opportunity to have that choice and control